Yes, because if you are empowered, you know the facts, you can avoid. No, if you are not empowered and you do not know the causes, then you will not be able to avoid it. So it means knowledge here is very, very key. You need to understand what causes infertility. What are the risk factors? Am I one of those who are at a high risk? At what risk am I exposed to? I must understand. So it is so key for you to empower yourself. You have to read and digest information. So that means for us to be able to avoid infertility, we must know the risk factors and we must know the causes. So what do we see in our practice among the clients whom we see? What are some of the causes? This analysis of this will help us understand what to avoid. How do I get into risk factors, okay? But before that, we will have to share simple biological knowledge. Now, I'd said that we're not going to use medical terms, and for sure we're not. Even the biology concept I'm going to share is basic and simple. So keep with me, and let's have a look at it. So what does it take to conceive? Simple biology, simple. Biology of conception. The biology of conception is very, very simple, and because pregnancy occurs in the woman, I will use the woman's reproductive system to make some illustration. Let's have a look at it over here. So it is simple. For the woman, she ovulates preferably once a month. In one cycle, she ovulates once. And in most cases, she's releasing one egg or two eggs. And that occurs about 14, 16 days from the beginning of her period. Now, when that egg is released, first the egg is growing in her ovary. This is her ovary. Sorry. I need to go back. I need to go backwards. Yes. Yes, this is her ovary. This is her ovary. So over here is her ovary, and the eggs are growing in. And it takes about 14 days, and the egg is released. Taken up in the tube, moves over, and at that point, if she meets with her husband or the partner, the sperms will be released into the vaginal canal, and the sperms will swim. They compete, and very many of them are there. They swim all through and meet with the egg right in the tube. That's where fertilization occurs, and a baby is formed. Now, by design, that fertilized egg is supposed to come back and back to the womb, attach here and grow. And then 9 months later, we have a baby born. Now, from this simple biological concept, we can see that there are about 4 things which are key players in conception. Just 4 things are key players in conception. So these 4 things include: 1, the woman's egg. The egg is so key. It's very important to have the egg. Without the egg, you can't have a baby. Number 2 is the sperm. You need the sperm for sure. The sperm is so key in ensuring that fertilization occurs, because the sperm and the egg meet to make a baby. And they meet in the tube. So the tube is the 3rd factor which must be functioning well. And the 4th is the womb. The baby must have where to grow. So these are the 4 key things. And if any couple has any issues with conceiving, these are the things which are usually affected. And if you are to get worried about your fertility, or if you want to get more information about your fertility, these are the things you look at. If you're a woman, you look at your eggs. Are my eggs okay? If you look at the tube, are my tubes okay? Do I have issues with the tube? Or can I possibly have issues with the tube? And the 3rd thing for the woman is the womb. Do I have any injuries to the womb? Do I have infections? And so that. And for the man, it's mainly issues to do with the sperm. So the health of the sperm is the key determinant of the man's Yes, so is the man's key determinant of the man's fertility. Yes. So based on that knowledge, what do we see in our population, in our practice? What do we see? We see that most of the cases of fertility are actually related to the fallopian tube, and they're related to the eggs. About a quarter of the cases are related to the fallopian tube, and a quarter are related to the sperms. So if issues of the sperm in the men are addressed, and issues of the tube in the female are addressed, we will be able to sort around half of the issues of infertility. So we're going to look at these factors bit by bit, each one of them, so that we're able to see how to avoid the problems related to each one of them, okay? Yeah. So let's look at the tubes. The biggest issue with the tube is blockage of the tubes. It's usually the blockage of the tubes, and there are a number of things which might block the tube. One is sexual transmitted infections. It's very important for you to know that we still have sexually transmitted infections in our population. This can be gonorrhea, can be chlamydia, it can be syphilis. We still have them. Another factor which we should openly talk about is abortion and related complications. This is very common because you find somebody has an unwanted pregnancy and they quickly think about removing the pregnancy. And because they hadn't planned for this, they do not take care of the post-abortion abortion management, and then they get complications of the abortion. Another factor is pelvic infection in women, often presenting as pain, periodic or continuous pain, before, during, and after periods. Another big group we are seeing emerging up are some new condition called endometriosis. Now, this condition initially was thought to be not common, but now because we are able to identify and manage it, we are seeing more and more of these cases. It's quite common, actually. 2 to 3 out of 10 women in the reproductive age in our population have endometriosis. Some of this is not identified, but we are seeing a number of these around. So how do you prevent blockage of the fallopian tube? Again, by looking at the causes of the fallopian tube, we can see that the most important thing here is healthy and responsible sexual behavior. Working on your sexual behavior is the most important thing in preventing problems of the fallopian tube. So what do we mean, working on having healthy and responsible sexual behaviors? Well, one of them is to delay sex. You know, sexual activity should be a privilege of people who are mature, both physically and mentally, so that you know the risks involved, you know the benefits involved, you know how best to avoid the problems related, you know. So it's important. So if you are not mentally mature, it's better to avoid sexual contact, because you could have a compromised decision, including a decision to get pregnant without being ready, and then you are forced to do abortion. So if you can avoid and delay sex, it will protect your tubes. Another one is this vice of network sexual activity. I mean, having more than one sexual partner. You have a boyfriend, then you have another one, you have another one, you have a girlfriend, you have a third one, you have a second one. And so, by definition, all those are, if you have two boyfriends and your boyfriend has 2 girlfriends, you are actually having 5 sexual partners by definition. And so sexual networking is one of the key problems we have. So if you can avoid network sex network, that will protect your tubes. Another thing is to protect your tubes from being blocked or being damaged is to use family planning methods. there are some family planning methods which prevent infections. For example, condoms. Condoms do prevent sexual transmitted infections like gonorrhea, chlamydia. And so if you're in a position where you feel like you cannot avoid sexual contact, then use a protective method like condoms. They will protect you. They are very simple. They might make you not to enjoy sex initially, but they are quite protective. You can use them. And to avoid unwanted pregnancy, you use these family planning methods. And so they don't cause infertility. They really don't cause infertility. Most of them, you can receive them cheaply, but they are mainly available. And you discuss with your health worker the use, how safely you can use them, how effectively they can be, and which one is suitable for you. So that is something we should be able to do. And it will help you prevent future problems with your tubes. And of course, as much as possible, try to avoid terminating pregnancies. As much as possible, try to avoid unwanted pregnancies so that you do not have to remove the pregnancies as much as possible. Because this is one of the key challenges, especially if it's done by non-professionals, non-medical workers, because there are so many masqueraders up there who are removing pregnancies and they have no medical training at all. So they damage people's systems and they damage people's tubes and they cause infections in these women. So as much as possible, try to avoid unwanted pregnancy and try to avoid abortion as much as possible for the health of your tube. And then again, in case you get these sexual transmitted infections like syphilis or gonorrhea, that is you have had like sexual contact, you're having abnormal discharge, or you're having abnormal abdominal pain, or you're getting fevers, or you're having pain on passing urine, please try to seek health care early so that this is diagnosed and it is treated appropriately. It might be a challenge for you to take that decision, but just know it has a protective effect on your tube in future. If the STD is treated early, you can avoid those complications. So what about the problem of the sperms? What about the problem of abnormal sperms? Now, as we had stated earlier that globally, the fertility of men is dropping, and that is worrying, and it is dropping steadily and surely. Initially, I think if you check in the last 20 years, the fertility has almost halved for the men. Almost, it has dropped to that extent. And it is very, very important for us to pay attention to this. Now, some of the causes of these changes, which we know of sperm abnormalities, include things like smoking. At some point, so many men were smoking in our population. Now it is reducing, but I've also seen some women smoking. But now, if your partner, who is a woman, is smoking, you're actually indirectly smoking. So it's your responsibility to not ignore that. You can talk to her and, no, it is not healthy for both herself and you. So, of course, apart from fertility effects, smoking also has other effects on your health. The blood clots, blood pressures, sugar issues. So all those things can come out through smoking. But in this case, it also lowers your fertility as well. It can damage your sperms and can affect production of sperms. Then the use of saunas and hot steam baths. This is becoming a modern sort of trend in the population. Some people doing it like almost every other day, others doing it daily. It's not very healthy for the men because, by design, the sperm production, proper sperm production occurs in a lower temperature. And that's why the testicles are hanged outside the body, because the body itself is hotter. But the testes need lower temperatures to function in terms of sperm production. And so if you go to the sauna, you are heating up the testes. And so you will interfere with its function. And so with this, it's important to not do it excessively. If possible, try to avoid. Some of these things are not necessary. You could, especially if you are still in the region of trying to conceive or trying to have pregnancies. So take care. And also excessive alcohol consumption is one of the things which is destroying our sperms. And finally, the use of what we call recreational drugs. Now, these illicit drugs are quite rampant in schools. Some of these have permanent effects, and you need to make sure that you check your children very well to ensure that they are not on these drugs, because they do not know, they may not be knowing the effects. And even in adults, it's very important to avoid these drugs. Some of these drugs, for example, are injections. I have seen some people on testosterone because they want to develop masculine features of strong muscles, strong sexual power. Yes, you may develop those features, but your sperm count goes down, and your ability to achieve a pregnancy therefore goes down. So you may become more masculine, but less fertile. And so you have to be very, very careful with that. So that means preventing this is very simple. Avoid these risky behaviors like excessive use of sauna, alcohol, use of illicit drugs. Just avoid them and you will get out of these problems. But also now we want to encourage people to do what we call reproductive planning. Now the concept of reproductive planning is straightforward. If you know that you are not yet ready to have children and you think maybe it's going to be delayed, or you are going to be involved in a risky venture, you can have your sperms kept in the fertility centers. A number of the fertility centers, including at Bethany, we have a modern sperm bank. You can keep your sperms here and they will be used later when you want. In case you don't get any problems, there's no problem with that. You can either give it away or you do something with it. You will not have lost anything. And keeping it is really cheap. So reproductive planning is very, very important. Don't be there and wish and wish. These services are available. You come over and have your sperms stored. So, yes, one of the challenges we are facing is, as we had looked at the factors, one of the factors we need to look at are the eggs. The egg, as we've seen that generally for the women over the years, their fertilities have remained the same. But what has happened is we have shifted, socially people have shifted to have their childbearing later because they are attending to their career. Now this has brought in the issue of the egg quality. So with the age, the quality of the eggs and their numbers drop down. Sometimes it is age, sometimes it is the use of medications and prescribed medication use of them. Sometimes it is genetic and sometimes it is infections. But you can avoid all these problems. And how you can avoid them? Again, reproductive planning. For the women, it is so important to do the reproductive plan. Again, we can store the eggs and you can always use them later in future. And so don't be there and rush to get married because your eggs are getting finished after getting the information. No, you can store your eggs. You come over, store your eggs, and you can use them later. And then secondly, irresponsible use of drugs. Now, some of these are real drugs. Some of them are lightening medications, steroids, which women use for lightening their skin. They are cosmetic products. And so you have to be very careful about what you use. If it's medication, don't use them over the counter. Please get a prescription. And once you've used the medication for something, don't continue to use the same medicine over and over. I had the same symptoms. Last time it was treated with this. Now, next time I go and buy again. And the pharmacy people have to help us to ensure that you need prescription for all these medications before you dispense them out. But in case you get any problems, like discharges, you have low abdominal pain, you have any challenges which are related to the reproductive system, it's better to seek help early. You go early, the problem is identified, it is sorted out before. And for example, if they detect that it is a problem which is likely to affect your eggs, they can advise you to do something about it earlier. So I think it's knowing what is going on, identifying the risk factor, and acting early is so key. What I don't know is whether we're supposed to have maybe a short break now and continue, or we can continue. I need to be guided.
If it's okay with you, we can continue. So we can maybe leave enough time for questions and concerns. I know people are planning things they want to plan. So if it's okay with you, we can continue. Unless you yourself wanted to catch your breath, but I think we can continue.
All right. I think we can make the presentation to the end, and then we will respond to questions. I hope the questions are already coming up. We can respond them accordingly to them accordingly. Yes, I'm not able to see the messages. Moses, do you have some already up? We can. My production team is inquiring if some messages are already there.
Yes, there are some questions from Pagana Winnie. She's asking, what would make a man's sperm count reduce?
Okay,
That's from Winnie. And then if you can maybe take notes of the questions, there are 3 so far.
So what
Winnie
we can...
is asking, what would make a man's sperm count reduce?
What will make a man's sperm count low? So I can have my notebook and note that somewhere down. I could have that noted down.
Okay. And then the second one, where leaves good for fighting infertility? Where leaves good for fighting infertility?
Sorry, the first one is what will make a man's sperm count...
Sperm count reduce.
Make a man's sperm count reduce to?
Wave leaves good for fighting infertility. Wave is G-U-A-V-E. You don't need to be mentioning it right.
W-E?
Wave, it's G-U-A-V-E. Wave leaves good for fighting infertility.
Grave.
Wave, that's how Gilbert has written it. I don't know that.
Maybe Gova.
Maybe Gova leaves.
Good for?
But Windo Gilbert, you can clarify maybe on that question for Doctor to get it better. And then someone is asking about the recording after the webinar for reference.
Okay.
And then the last one, before you can look at those, is thank you, Doctor, for this presentation. That is from Dennis. Thank you, Dennis, for appreciating. What could be the presenting signs and symptoms for the endometriosis?
Okay.
Would you recommend routine USS?
Okay.
Now, I think those are medical. I'm reading them the way they are.
It's okay. No problem at all.
And then there is this one, Dr. Maybe, and then we shall maybe first answer those.
Yes.
From anonymous attendee.
Yes.
I have ever aborted more than twice on a scale of 1 to 10.
Yes.
How am I most likely to face infertility? I repeat, if I have ever aborted more than twice on a scale of 1 to 10, how am I most likely to face infertility?
All right. Let's
first open those, there are others, but let's first answer those.
Okay, thank you so much, Moses, and the viewers for those questions. That means you are following. So I will be referring to the questions and also some of the slides for illustration. What will make a man's sperm count reduce? What would make a man's sperm count reduce? So earlier on, we had discussed some of the things which may affect the sperm count. We talked specifically about smoking as one of the factors responsible for reduced sperm count. Now, the issue with smoking is it doesn't only affect the sperm count. Now we know it goes beyond just the count. It damages the genetic material of the sperm. We're now talking about DNA fragmentation. That's how far the problem has gone. And currently there are a lot of studies evaluating the importance of the breakages of the genetic material due to such things like smoking. We are seeing this manifesting in low fertility, but also we are seeing this manifesting in the quality of the babies, that is the biological quality of these babies. We think it could also translate later into the development of the person. For example, if a baby is from a man who smoked a lot, we are thinking it could in future cause issues to do with the mentation, the ability, the cognitive ability, and all that. So it has a wider ramification. So smoking is one big key factor. Another factor is the behavior of using saunas and hot tubs. You know, these sort of practices are becoming rampant. People are going to the sauna almost every day, and this is not very good because by design, sperm is supposed to be produced in a lower temperature area. That's why God designed the scrotum to hang outside. Otherwise, it would be inside. And so, if you subject the sperm, the testes constantly to higher temperatures, the production of sperms will go down. And that is very, very true and has been proven. And another one is alcohol binge. Excessive alcohol consumption has toxic and poisonous effect on sperm production, and we must try as much as possible to avoid it. And another practice which is bad for the sperm is the use of illicit drugs. Now, one of the things which is also becoming in our population common is people wanting to look masculine. And they go as far as injecting themselves with steroids so that they develop muscles, you know, they want to look manly, and they take so many medications for that. Now that is very bad for the sperms. You may look masculine, but your sperm count is going down because these are hormones and they interfere with the normal functioning of the sperm production system. So these type of behaviors are the commonest which you can avoid. But of course, some people have genetic problems which translate into low sperm count. Those are not so many, but they are there. And then others get infections, like infections of the testicles, like from viruses like mumps. And that's why it's important to encourage vaccination of mumps so that you do not have these issues. So those are some of the few things which can cause the sperm count to go low. And many people have low sperm count in our population. That's the truth. It's the truth. 20 to 30% of the couples that come to our unit for fertility treatment, the problem is in the sperms. And this is so true. The problem is in the sperm, so you may find you're blaming your woman, the problem is the sperm. The second question is about the use of guava leaves for fighting infertility. Now, these are herbs. Some of these herbs, it's very hard to tell whether they do have an effect or not. Many of these have not been proven, so I cannot say much about the use of guava leaves. For the recording, well, you will have to, I'm very sure they will provide that. Moses is there. I think he's working on that. He will make that available. And also our team, our technical team from Bethany. So I have two other questions to answer now. And one of them, next one, is very, very important. What are the signs and symptoms of endometriosis now? Among the causes of fertility problems in women, we are beginning to see a lot of endometriosis, this condition called endometriosis. Now, endometriosis, by definition, in endometriosis, what happens is, now, normally, Normally, let me see this. I can go backwards. I can go backwards a bit. Yes, this just for illustration. So, let's look at this. So, now this is the womb. This is a womb. This is the womb. Now, within this womb of the woman, there are muscles. It's made up of muscles, the wall. We have the muscle, and inside there's a thin lining of the skin. Now, this is the one which sets off during menstruation. Every month, it responds to hormones, it grows up, and it sets off every month. Now, this lining here is called endometrium. By design, by normal design, this tissue is only supposed to be inside here. It's not supposed to be anywhere else. Now, in endometriosis, because it is a disease, in endometriosis, this type of tissue develops in other parts of the body. So you can find it on top of the womb, you can find it on top of the ovary, you can find it anywhere, even in the lungs. And that is the disease called endometriosis. Now, because it is the similar tissue here, what happens is that when the woman is supposed to get her periods, the tissue, wherever it is, will also shed blood. For example, if it is on the tube, it will shed blood, and the blood will clot and cause scarring and block the tube, or it can cover the ovaries. And so that is how it causes infertility. But that is also how it causes its symptoms. Because the blood is not coming out, it causes irritation inside. So these women will have pain during her periods. The pain gets worse during the period, and it is so severe that medications may not work. And with subsequent periods, the pain gets worse and worse. And so that is the classic presentation of endometriosis. Painful periods which keeps on getting worse and worse. And at some point, it fails to respond to medication. And then such people also have issues with conceiving, because the endometriosis can also damage the tubes and can also prevent ovulation. So the commonest presentation of endometriosis is painful periods, severe painful periods, and infertility. And if the woman is active sexually, she will have pain on sexual intercourse as well. The other thing is somebody is concerned they have had abortion 5 times. And what is the risk of getting infertility? As I had stated earlier, termination of pregnancy is associated with increased risk of infertility. That is for sure. And the risk is, the more number of terminations you have, the higher the risk of the pregnancy. I can't give you exact number, but also the numbers, the higher the number, the higher the risk. And how it was done also, that increases the risk. For example, if it was done, sometimes they remove the pregnancy using medication. Sometimes they remove the pregnancy using, they take you to the theater and they clean out. Now, the clean out has a higher risk than the medication, especially if the pregnancy is bigger. Now, also, the bigger the pregnancy in terms of age, the higher the risk of damage of the tubes. So you can't have a particular figure, but for sure, the higher the number, the higher the risk of getting infertility. But to relieve your anxiety, I think you can undergo an evaluation of your tubes and your ovaries to see if there is any complication already or not. Yes, those are the questions which are here apparent for now. Okay, so there's one which they're going to send now. Let me have a look at it. Yes, 41 years old. What are the risks of my bearing child at this age? Can fibroids hinder pregnancy? Those are 2 questions. Yes, Immaculate. Okay, so let me first answer this one I've read by Immaculate. Yes, Immaculate, this is a concern, yes. At 41, if you do not have any other issues, you can still bear a child as long as you're having your periods, but the risk there is now the issue of the quality of the eggs. Is now the quality of the eggs at 41. So, but the quality of the eggs, you can test them. The quality of the egg, You can go to the hospital, they can test hormones, they can evaluate if you have fibroids or not. So all those things can be done, and then you will have information specific for yourself so that you don't have just general information. Fibroids, most cases, fibroids do not affect somebody's ability to conceive, but they can cause miscarriage, especially if fibroids are peeping inside. Fibroids are being over-stigmatized. For sure, they need to be attended to, but not all fibroids need to be treated. Some of them, you can ignore them, but it is the health worker to decide which one is significant, which one is not significant. Another question I missed out was about necrosospermia. Is that a question? I need an access to. Oh yes, how can we fight necrosospermia? Yes, they even gave explanation for this. Yeah, so necrosospermia is a condition, one of the abnormalities of sperms, where the sperms are dead. Sperms are there, they are well formed, but they are dead. Now, there are different causes of necrosospermia, the sperms being dead. If the sperm is well formed, that means where it is being produced, the production is okay. Then along the way, maybe in the storage of where it is stored, there's a part where it is stored before it is being released out. That could be where the problem is. Now, necrosospermia has to be first investigated for what is causing it. If the cause cannot be identified specific, then this is a person who will need IVF. You will need IVF so that the sperms which are used are those which have not reached the store. So they can get the sperms directly from the testes and use them for IVF, and you will have your children. Yes. But you are asking how can you avoid it? But the most important is to find out what is causing it first. And you can't do that yourself. The health worker has to help you. There are different causes of necrosospermia. Sometimes you could be having an infection within your system, killing the sperms. Yes. So, yes, please. Yes, the question is, I would like to know how manpower products have contributed to men's infertility among men. Yes, exactly. I like that type of question because now he's talking about medications which are branded to enhance sexual performance of men, how it is contributing to infertility. Now, this depends on the type of manpower. Initially, people used to use simple manpower in the population. Now they are going for injectables, steroids, and we are beginning to see those reducing the what? Reducing the fertility and the sperm counts. So I think the problem is just at the infancy stage, and it's going to become worse if people don't reverse that. It is both for recreation, but also for purposes of performance at home, because the world is getting very stressful, and some men are failing to perform in their homes, and so they are looking for all opportunities, and then they are getting medications prescribed by health workers who may not be understanding the implications. Some of the people are not health workers, so the problem is just beginning, I believe, and it might most likely get worse if we do not educate the population. Yes, another question? Yeah, Moses, I think we've answered a few of the questions. We could continue with the webinar.
Yes, let me just read this quickly.
Okay.
My questions keep coming. There's one that is saying, how true, thank you, doctor, for the presentation. How true are the assumptions of men who move on borders on roads with huge potholes, who claim their testicles are affected by unnecessary shakes? Is this in any way linked to infertility? He's trying to ask about borders and men. I think we picked that one. Can respond to it. Then, from Anne Bauer.
Yes.
Thank you very much, doctor, for enlightening us about the basics of fertility and the measures of prevention. IVF is one of the methods used to give families hope of bearing children after going through infertility. How do you how do these families, or how do these families confidence? I think, how do you give these families confidence of getting a healthy, normal baby, free of anomalies like syndromes? Are there screening procedures in Uganda? That is from Anne. Can I repeat?
I got it. I think she's saying she appreciates that IVF is one of the methods we use for helping people who have infertility. How can we assure people that it is safe in terms of the outcome, the babies, that it may not cause damage to the babies and abnormalities in the babies? I think that's what she's asking. Yes, I got it. Unless if there's another question.
Yes, this last one.
Yes.
I visited a certain guy and told me that my husband's testicles have a problem on creation. So he was advised to do IVF and due to low sperm count.
Yes.
Is there a chance for him to bear children?
Okay, so those are very nice questions. Yes. So one is the border, and another one is safety of IVF, and another one is somebody who has the congenital anomaly of testes. Okay, yeah, so these are very interesting questions, certainly, yeah. About the borders, whether moving on the borders and on the potholes can affect the men's fertility. Now, we are aware that anything which causes damage to the testes, whether slight or severe, it sometimes is very slight, can actually lead to infertility in these men. That's why we talk about the sports, these rough sports like rugby. You find many of those men end up later in future, and some of them end up in future having issues with fertility because of the small damages, because the testis has a way in which it will destroy itself if it gets a small injury. Even in one test, it can destroy both testes by itself. It has a way in which it can do that. So with this in mind, one would think that anything which is rough on the testes, like maybe a pothole, border, somebody moving a border. Now, the truth is we have not evaluated this. We cannot say that people should not move on the border as men because of that reason. So I cannot confidently say that this is true or not, because this is like a new phenomenon. The border phenomenon is somehow new in our population, so you can't say so. But it is true. If you play around with the testes and you damage it, you can easily get more damage even on the normal testes. In terms of the safety, and yeah, it is true that IVF is helping so many. Through IVF, we're helping so many families to have children, whether it is blockage of tubes, low sperm counts, and so the technology of IVF is helping a lot of them. And it has been in place since 1978, so these are very many years now. So in terms of safety, I can tell you that IVF is a very safe treatment for both the couple and the child. And for the since the beginning of IVF, 1978, this has been one of the things concerning IVF that people have been paying attention to pay attention to the risk of abnormalities, specifically related to the IVF procedure. We can confidently say that IVF does not have any special risk to the baby. Babies born from IVF are normal. They live normal lives, they will function normally. If they have any issues, those issues would have happened in them, even if they were conceived naturally. So there's no special risk really. The only thing we are having some bit of concern about is there are certain congenital problems which stop people from getting a child. And IVF helps us to overcome some of those problems. For example, some men who have low sperm count or even absent sperms, some of them have congenital problems, for example, called cystic fibrosis. Now, this cystic fibrosis is a condition which may be mild and present itself as abnormal sperms or low sperm count. Now, and in such a case, such a person will not bear children. But if you help that person bear children, that condition can be transmitted to the child. And so the child might either, if he's a boy, might get such a condition again with low sperm count, or may get other severe forms of cystic fibrosis, like lung issues and all this. This is the only concern. But now we are also able to do genetic diagnosis so that you are able to see if somebody has such a problem, and then you're able to take action to prevent the genetic problem coming. So it's safe, that's what I can say. Then one of the viewers is asking, that is saying that the man has low sperm count, and the doctor explained that the low sperm count was because the testis was abnormally formed. Does he have a hope? Now, usually if somebody has a low sperm count or no sperm seen in the fluid at all, the first thing is to find out, is there any production or not? If there is some level of production, then such a person can be helped through the process of IVF to bear children. Now, most cases of abnormal positioning, especially of the testicles during formation, must be corrected early if their effects are supposed to be stopped. So they should be corrected within the first 6 months of the child's life. If it goes into adulthood, in most cases the effect has already occurred. Repositioning the testicle may not matter so much. But what we need to do in such a case is to see where the testicle is it functioning? And if it's functioning, they could recover some sperms from it, and maybe for purposes of safety, sometimes remove the testicle. Or position it in just a way that it can be safe, but not for purpose of producing sperms. Yes. Are we ready to continue? Or there are more questions? We risk to open the questions early, so we might not finish the presentation, which is okay.
Let's answer this one last one.
Yes.
Posted in the chat, and then we can go to the presentation.
Yes.
It's saying, can fibroids be removed after getting a C-section after 2 years?
Can fibroids be removed after getting a C-section after 2 years?
After 2 years.
Yes, fibroids can be removed, but not during C-section. Yeah, fibroids can be removed, that is true, through surgical procedure, but not during the C-section delivery, because the risk of bleeding is usually very, very high during the time of delivery. But after delivery, they can be removed, and it will be fine.
Okay, thank you. I think we are almost running to the end of our session, so we can continue with the presentation first, and then we'll see.
I think there's one question from the chat, I think. YouTube, so there's a question, I think, it's by Jackson. How do after pills affect the egg production, and what are some of the effects if used often? Okay, I think he's asking about morning after pills. Now, these are sometimes called emergency contraception. People use them when they have unprotected sexual intercourse and at a time when they suspect they could get pregnant, or any other time, to prevent, in the emergency situation, occurrence of pregnancy. So they can be pills, they can be sometimes IUDs. So he's asking, do these affect fertility? The answer is no, even if they're used for a long time. The only problem with frequent use of emergency contraception, the only problem is they are not designed for regular use. But if you find yourself in a situation where you must need it all the time, you have to examine yourself. Don't you need something else? If you are using them frequently, why don't you use a proper family planning method instead of running for emergencies? That means you have a regular sexual contact. Then you need family planning. They are best for irregular sexual contact. Yeah. Yes, Moses, we go back to the presentation now.
Yes, I think we can continue with the presentation now.
Yes. Thank you so much for those questions. They are very enlightening, and some of them would be addressed later, but I think they are very, very important. So we were talking about the egg as one of the factors, one of the key players in infertility, and we're saying that for the woman, there is a prescribed time during which the egg quality starts going down, and that time is a natural process. And one of the ways of avoiding the problem is to do reproductive planning. You can store your eggs so that you don't have to struggle later in the future, and you can always use them. But also you need to pay attention to things like unprescribed medication. Don't take medication before they are prescribed, including these cosmetics. Read carefully what is in the cosmetics, because some of these things have effects on the quality of eggs. As a woman, you know you have a fixed number of eggs and you cannot increase them, so don't play with them. And of course, infections, when you get infections, please take action, okay? Oh yeah, actually we are coming to the conclusion. Actually, I didn't see that. So you need to be responsible. You use your drugs responsibly. You need to do reproductive planning. You need to do reproductive planning because in case you are not yet ready to bear children, you can store your eggs and you can always use them later. Don't use medications which are not prescribed. And in case you have symptoms of STDs like discharges or you have pain, please take action early, because when they are treated early, you will have better outcome. And finally, you are the one who is responsible for yourself. So in my conclusion, I would conclude like that: the health and proper functioning of your reproductive system is very, very important. That is for everybody, whether you're going to use them or not. And it is your responsibility, not somebody else's responsibility. Don't say my gyno is the one responsible for it. No, it's you who is responsible. You have to take care and charge of it and seek help early to avoid complications like infertility. Otherwise, I wish you a very good reproductive health. Thank you.
Thank you very much, Doctor. I think I really need to applaud Doctor for this presentation. This is much needed knowledge. Doctor, thank you very much for those insights.
You're welcome.
I just want to maybe inform, in case of more, you can always reach to Bethany Women's Hospital, and I think you'll be helped because, yes, this might have been a start of enlightening us, but for more, you should reach out to Bethany Women's Hospital. You will definitely get more information. And for Unicaf University, if you need to study, you can reach out to Unicaf University. Again, 0771-976-750. And because of this partnership, we are able to extend an 80% scholarship on bachelor and masters and 70% scholarship on the doctoral programs. Thank you very much for being part of this discussion. Those who have asked questions, thank you very much. They have really guided the discussion, and I think we've benefited much. Dr. Gay, thank you very much for your time and presentation of sharing this knowledge. Really, knowledge is power, and therefore if we get a platform where we can learn, then we jump to it. So thank you very much. Those who have attended, thank you very much. You can always reach out. Those who want the recording, yes, like us with Bethany TV and Unicaf, we will definitely share Doctor's recording for the information. For now, have a nice lunch. It's coming lunchtime, and have a blessed weekend ahead. Thank you.
Thank you.